Hi, it's Sean Nyden again from Leeds Frailty Education. In our last video, we talked about identifying frailty using the clinical frailty scale. I'm here now to talk to you about how to use that scale. Remember, we shouldn't be judging people when they're acutely unwell. Rather, we should be judging people 2 weeks before they became ill based on their usual level of function. To do that, we need to ask some specific questions, and if the person can't tell us what's wrong with them, we might need to get a collateral history from somebody who knows them well. We'll need to ask some specific questions about activities of daily living. We'll need to ask people how they get in and out of bed, how they wash or bathe themselves, how they eat, and how they walk. In addition, we'll need to ask some questions about higher activities of daily living. This will include things like how someone manages their finances, how do they do their shopping, how do they prepare their meals, how do they take their medications, and whether they can use a telephone. For people who are completely independent, we'd also want to know whether they can exercise and how vigorously or strenuously they can exercise. So let's go through the scales in a bit more detail. Clinical frailty score of 9 is for those people who are terminally ill and doesn't require much more explanation. A clinical frailty score of 8 is somebody who is in their last few months of life. This is somebody who is typically taken to bed, and you wouldn't be surprised if their next infection might be their last illness. For people with clinical frailty scores of 6, moderate frailty, and clinical frailty scores of 7, severe frailty, then we need to start asking those questions about activities of daily living. Remember, these were getting in and out of bed, washing and bathing, eating, and walking. For people with clinical frailty score of 7, they are likely to need help with most of these things. For somebody with a clinical frailty score of 6, they might need help with 1 or 2 of these things. So typically, they might need help with personal cares, they might need help with bathing, they might need help going outside of the house, but they're not completely dependent for personal care. People with a clinical frailty score of 5 tend to be independent with personal care, but need some help with those higher activities of daily living. So they might need help with things like shopping, cleaning, meal preparation. They might need help every time they go outside the house. Somebody with a clinical frailty score of 4 doesn't actually need help with anything. This person is actually living an independent life, but they are physically slow. Everything is an effort. So this is the sort of person that you might see in the shops, but walking slowly with a trolley. Somebody with a clinical frailty score of 3 is active and independent. They are not visibly slowed. They can do everything for themselves, but they don't exercise. Somebody who's got a clinical frailty score of 2 is a sort of person that might take exercise occasionally or seasonally, but they're not regularly exercising. Whereas the person with a clinical frailty score of 1, well, they are amongst the fittest for their age. They exercise regularly. So the clinical frailty scale is a good way of identifying people at risk, particularly those at moderate or severe frailty. But it also helps us use a common language to describe someone's function and helps us to put in place different interventions for different levels of frailty. To learn more about frailty, follow our social media platforms.